Hello everyone, hope you all are fine. Welcome to Agram IS Academy. Let's begin our topic health. First is fortification of salt. India made fortification of salt with iodine mandatory for direct human consumption in 1992. Gujarat is the largest producer of salt. Gujarat produces 71% of the salt, followed by Rajasthan at 17% and Tamil Nadu at 11%. The rest of the country accounts for a mere 1% of salt produced. Iodine is a vital micronutrient for optimal mental and physical development of human beings. Deficiency of iodine can lead to hypothyroidism, abortion, stillbirths, mental retardation, and psychomotor defects. Children born in iodine deficient areas may have low intelligence quotient, that is IQ. Next is zoonotic diseases. Zoonotic disease are the disease which spread between animals and people. Okay, here it is. Next is Kyasanur forest disease, that is KFD. Okay, how this disease spread, here it is. Okay, just go with this facts thoroughly. Okay, KFD is a tick-borne viral hemorrhagic fever endemic to South India. Transmission to humans may occur after a tick bite or contact with an infected animal, most importantly, a sick or recently dead monkey. No person-to-person transmission has been described. A vaccine does exist for KFD and used to endemic areas of India. Next is total polar compounds, TPC. According to FSSAI regulations, the maximum permissible limits for total polar compounds have been set at 25%, beyond which the cooking oil is unsafe for consumption. In many countries, TPC is used to measure the quality of oil. During frying, several properties of oil are altered. TPC are formed on repeated frying. High level of TPC in cooking oil leads to health issues like hypertension, atherosclerosis, Alzheimer's disease, and liver disease, like Alzheimer and this hypertension. This type of disease cause of TPC cooking oil. That TPC is in the oil, cooking oil. So you can contact us if you have any type of query, doubts, want to join test series, mentorship program. Our number is 888-345-6893. Also, you can join our Telegram channel, that is Agram IAS. We are in Instagram also. Instagram username is AGARAM IAS Academy, ACADEMY. So join us there. Next is Medicines Sans Frontiers, MSF. Okay, Medicines Sans Frontiers Doctors Without Borders is an international independent medical humanitarian organization. It provides medical assistance to people affected by conflict, epidemics, disasters, or exclusion from healthcare. The teams are made up of health professionals, logistic and administrative staff, most of them hired locally. Okay. Next one is Canine distemper virus, that is CDV. Just go with this picture thoroughly. Okay, why it's in news? Canine distemper virus had caused the death of Asiatic lions in Gir Forest, Gujarat. CDV causes a highly contagious and life-threatening disease in dogs. CDV also affects other wild carnivores such as wolves, foxes, hyenas, tigers, and lions. CDV spread through aerosol droplets and through contact with infected bodily fluids, feces, and urine. The virus infects the respiratory, gastrointestinal, and central nervous system. The next is replace campaign. Okay, Just go with this fact thoroughly, mentioned on picture. Okay. The World Health Organization WHO replaced campaign aims to eliminate industrially produced trans fatty acids from the global food supply. Okay. Next is notifiable disease. A notifiable disease is any disease that is required by law to be reported to government authorities. The process helps the government keep track and formulate a plan for elimination and control. Any failure to report a notifiable disease is a criminal offense, and the government can take necessary action against defaulters. The center has notified several diseases such as cholera, encephalitis, leprosy, plague, TB, AIDS, malaria, dengue, etc. Okay. Next is poliomyelitis. Okay. Here it is, the picture over here, the vaccination schedule and what is polio, the strains. There are three types of strains basically. Virus strains are P1, P2 and P3. Okay. And India attained a polio-free status in 2014 successfully. Wild P1 and P3 strains. Here it is the difference between IPV and OPV. Okay. IPV killed formalized virus given IMSC, induces circulating antibody, no local immunity, prevents paralysis, does not prevent reinfection by wild poliovirus, not useful in epidemics, content 10,000 times more than OPV, costlier, is very costly also, does not require as stringent conditions during storage and transportation. And simultaneously, if we see about OPV, that is live ununited virus given orally, and both humoral and intestinal immunity, prevents paralysis and intestinal reinfection, effective in controlling epidemics, and it is cheaper also as compared to IPV, requires to be stored and transported at sub-zero temperature unless stabilized. Okay. And this is the life cycle of polio. Just go with this picture thoroughly. Okay. Okay. Basically, polio is a highly infectious viral disease that largely affects children under 5 years of age. The virus is transmitted by person to person and spread through contaminated water or food. In a small proportion of cases, the disease causes paralysis, which is often permanent. There is no cure for polio. It can only be prevented by immunization. As of 2020, wild poliovirus P1 affects only 2 countries in the world, that is Pakistan and Afghanistan. Okay. Next is multi-drug resistant tuberculosis, MDR-TB. Writes in news, US Food and Drug Administration FDA has approved a new drug Prelims for treating drug resistant tuberculosis. Tuberculosis TB is a disease caused by bacteria that are spread from person to person through the air. TB usually affects lungs, but it can also affect other parts of the body such as the brain, the kidneys or the spine. In most cases, TB is treatable and curable. However, persons with TB can die if they do not get proper treatment. People with TB who do not respond to at least isoniazid and rifampicin, which are first-line TB drugs, are said to have MDR-TB. Rifamycin and isoniazid are the first-line TB drugs. Okay, here it is. Next one is Jan Orshadi Suvidha. Just go with this picture thoroughly. Basically, Jan Orshadi, Pradhan Mantri Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana. This is a quality medicines at affordable prices for all. Jan Aushadhi Suvidha is a sanitary napkin launched under Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, that is PMBJP. Okay, it is biodegradable when it comes in contact with oxygen after being discarded. In a huge push for women hygiene, the government slashed price of sanitary napkins sold from its Jan Aushadhi canes to just rupees 1 per piece from 2.50 paisa earlier. Next is hepatitis C. Hepatitis C is a liver disease caused by the hepatitis C virus. The hepatitis C virus, HCV, is a blood-borne virus, and the most common modes of infection are through exposure to small quantities of blood, through injection drug use, unsafe injections practices, transfusion of unscreened blood. There is currently no vaccine for hepatitis C. Okay? Hepatitis C is not spread through breast milk, food, water, or by casual contact within an infected person. People with HIV infection are at increased risk of hepatitis C virus infection. Next is TB Harega, Desh Jeetega campaign. Okay, make TB the enemy and TB patients your friends. This is the tagline. This is the line of the campaign, and the tagline is TB Harega, Desh Jeetega. Okay. Widespread news. TB Harega, Desh Jeetega campaign has been launched with an aim to eliminate tuberculosis from India. Campaign aims to improve and expand the reach of TB care services across the country by 2022. The government aims to provide free of cost and high quality TB care to all the patients, both at private and public hospitals. United Nations has marked 2030 as a global target to eliminate TB worldwide, but the government of India has made 2025 as its target to eliminate tuberculosis from the country. Next is African swine fever, ASF. Just go with this picture, how it spreads. Okay. African swine fever is a severe viral disease affecting domestic and wild pigs. It was first detected in Africa in the 1920s. The mortality is close to 100%, and since the fever has no cure, the only way to stop it spreading is by killing the animals. ASF is not a threat to human beings since it only spreads from animals to other animals. Okay, next is Jan Aushadhi Sugam. This is basically a mobile application. Jan Aushadhi Sugam. Okay, Union Ministry for Chemicals and Fertilizers has launched a mobile application, that is Jan Aushadhi Sugam. Okay, the app aims to enable people to search Jan Aushadhi generic medicines and the stores at the tip of their fingers. It will also help analyze product comparison between generic and branded medicine in terms of MRP and overall savings. Next is Rural Sanitation Strategy. The Department of Drinking Water and Sanitation, DDWS, Ministry of Jal Shakti, Government of India, launched a 10-year rural sanitation strategy, that is 2019 to 2029. It focuses on sustaining the sanitation behavior change that has been achieved under the Swachh Bharat Mission Gramin SBMG. It ensures that everyone uses a toilet and every village has access to solid and liquid waste management. Next is Oxytocin. Here, picture is here. Just go with these facts thoroughly. Okay, and what is Oxytocin? Oxytocin. Basically, oxytocin in a hormone secreted by the pituitary gland, and it plays a role in reproduction, childbirth, and lactation apart from social interaction. Oxytocin is used to both for humans as well as for animals to accelerate normal labor. Okay, it is supposed to act directly on the uterus to induce rhythmic contraction. In certain animals, especially farm animals, it is used to achieve milk letdown. Oxytocin is believed to stimulate the mammary gland and induce milk production in farm animals, provided the udder is prepared to do so. Okay, next is measles and rubella. Okay, just go with this picture thoroughly. Okay, measles is a viral infection on the respiratory system that can spread through contact with infected mucus and saliva. Rubella is a contagious disease that mostly affects children. Rubella is usually mild in kids, but it can be more serious in pregnant women. Next is brucellosis. Okay, brucellosis in humans. Just go with this picture thoroughly. Okay, brucellosis is primarily a disease of animals caused by a group of bacteria from the genus Brucella. Infection of people is acquired from cattle, dogs, pigs, or sheep and goats, usually by direct contact with infected animals or by consumption of unpasteurized raw milk or cheese. The bacteria will spread to humans if the milk is consumed without boiling. Since milk is generally boiled, it is unlikely to be cause of concern. Next is hepatitis. Hepatitis means inflammation of the liver. When the liver is inflamed or damaged, its function can be affected. It causes heavy alcohol uses, toxins, some medications, and certain medical conditions can all cause hepatitis. However, hepatitis is often caused by a virus. Hepatitis A, hepatitis B, and hepatitis C are liver infections caused by 3 different viruses. Hepatitis A is usually a short-term infection. Hepatitis B and hepatitis C can also begin as short-term infections, but in some people, the virus remains in the body and causes chronic or lifelong infection. There are vaccines to prevent hepatitis A and hepatitis B. However, there is no vaccine for hepatitis C. Okay, the hepatitis B virus is spread when blood, semen, or other body fluid of an infected person enters the body of a person who is not infected. Next is bioterrorism. Okay, just go with this definition thoroughly. Okay, bioterrorism is the intentional release of viruses, bacteria, or other germs that can stick in or kill people, livestock, and crops. Bacillus anthracis, the bacteria that causes anthrax, is one of the likely agents to be caused in a biological attack. Next is Swachh Bharat. Just go with this picture thoroughly. And so the facts are there. Like 93.1% of households achieved access to toilets. Okay, reduced death due to diarrhea, malaria, and thereby improved child health and nutrition. Savings from a household toilet exceed the cost to the household. And incorporate environmental and water management issues for sustainable improvements in the long term. These are the parameters of Swachh Bharat to Sundar Bharat via Swasth Bharat. This is the campaign. Okay. Next is Salmonella. Salmonella is a group of bacteria that can cause foodborne illness known as salmonellosis. The World Health Organization (WHO) identifies salmonella as one of 4 key global causes of diarrheal disease. Children under the age of 5 are at highest risk of salmonella infection. Older adults and people with weakened immune systems too are likely to have severe infection. Okay. Next is foot and mouth disease, that is MFD. Okay. Okay, just go with this facts thoroughly. Okay, why it's in news? Prime Minister Narendra Modi launched the National Animal Disease Control Program, that is NACDP, to control and eradicate the foot and mouth disease FMD and Brucellosis amongst the livestock in the country. It is a 100% centrally funded program. It aims to control foot and mouth disease and brucellosis by 2025, with vaccination and eventual eradication by 2030. Foot and mouth disease FMD has severe implications for animal farming since it is highly infectious and can be spread by infected animals through aerosols, through contact with contaminated farming equipment. Humans infected with foot and mouth disease through contact with infected animals is extremely rare. Next is pneumonia. Pneumonia is a form of acute respiratory infection that affects the lungs. The World Health Organization (WHO) identifies pneumonia as the single largest cause of death in children worldwide. Every year, it kills an estimated 1.4 million children under the age of 5 years, accounting for 18% of all deaths of children under 5 years old worldwide, according to the WHO. This despite pneumonia being preventable and treatable. Infectious agents may include bacteria, viruses, and fungi. Children and the elderly above the age of 65 years are especially vulnerable. Next is Eat Right India movement. The tagline of Eat Right India is Healthy, Safe, Fortified. And this is the initiative by Food Safety and Standards Authority of India, that is FSSAI. Okay. Union Health Minister Harshvardhan launched the Eat Right India movement of Food Safety and Standards Authority of India, that is FSSAI, with its new logo and tagline Sahi Bhojan, Behtar Jeevan. Okay. The Eat Right India movement is a year-long social and mass India campaign of Food Safety and Standards Authority of India, FSSAI. The movement aims to cut down salt, sugar, and oil consumption by 30% in 3 years. It also aims to engage and enable citizens to improve their health and well-being by making the right food choices. This movement is aligned with the government flagship public health program such as Poshan Abhiyan, Anemia Mukt Bharat, Ayushman Bharat Yojana, and Swachh Bharat Mission. FSSAI has prescribed a limit for total polar compounds (TPC) at 25% in cooking oil to avoid the harmful effects of reused cooking oil. Okay. Here it is. The picture is here. How the Eat Healthy program initiative is going on. Like balanced diet, eat less and eat timely. Diet diversification, eat variety. Eliminate toxic industrial trans fats. Reduce consumption of salt, sugar and saturated fats. Eating fortified staples to address micronutrient deficiency. Okay. Next is Bharatiya Poshan Krishi Kosh. Why it's in news? The Ministry of Women and Child Development (WCD) along with Bill and Melinda Gates Foundation has launched the Bharatiya Poshan Krishi Kosh (BPKK). The BPKK will be a repository of diverse crops across 128 agroclimatic zones in India for better nutritional outcomes. The course aims at reducing malnutrition through a multi-sectoral results-based framework including agriculture among women and children across the country. Okay. Next is maternal mortality in India. That is MMR, maternal mortality ratio. Here it is. Just go with this graph thoroughly. Okay. What's in news? A special bulletin on maternal mortality in India 2015 to 2017 from the sample registration system has been released. Maternal mortality ratio is measured as the number of maternal deaths per lakh live births. Kerala has the lowest MMR at 42. It is followed by Maharashtra 55, Tamil Nadu 63. According to the United Nations UN Sustainable Development Goals SDGs, the global target is to bring down the MMR to fewer than 70 maternal deaths per 1 lakh live births by 2020. Okay. Okay. So next one is Rigpa. Sova Rigpa is one of the oldest living and well documented medical tradition popular in the world. It is an ancient Indian medical system which was enriched in the entire trans-Himalayan region. At present, Soha Rigpa is more popular in Himalayan societies, especially in J&K region, Ladakh, Himachal Pradesh, Lahore and Spiti, West Bengal, Darjeeling, and Sikkim and Arunachal Pradesh and other parts of India. Okay. It is also being practiced in countries like Bhutan, Mongolia and Russia also, etc. Soha Rigpa is formally recognized and promoted as traditional medical system by the government of India. The majority of theory and practice of Soha Rigpa is similar to Ayurveda. Next is SANS campaign. Health Ministry launched this SANS campaign. Okay. SANS a campaign aimed at reducing child mortality due to pneumonia, which contributes to around 15% deaths annually of children under the age of 5. SANS, short for Social Awareness and Action to Neutralize Pneumonia Successfully, was launched to mobilize people to protect children from pneumonia and train health personnel and other stakeholders to provide prioritized treatment to control the disease. Okay. Next one is National Health Profile 2019. Just go with this graph thoroughly. And just go with this graph thoroughly too. The second graph is there. Okay. Basically, on this, the making the nation's nutrition secure, government launches the Bharatiya Poshan Krishi Kosh, that is BPKK, and these are the 5-point action program to be implemented that ensure calorie-rich diet for women, ensuring intake of proteins, hidden hunger due to deficiency of vitamin, ensure clean drinking water supply, nutrition literacy in every village. Okay, these are the basic points, parameters you can say. Here it is, and this is the percentage of pneumonia, tuberculosis, malaria. Just go with this picture thoroughly. Okay. Okay. Next is malaria eradication in India. Okay. Wides in news, the Indian Council for Medical Research has launched the Malaria Elimination Research Alliance, that is MERA, India, to eliminate the disease from India by 2030. Over the past 2 decades, India has made impressive progress in malaria control. The malaria burden has declined by over 80%, 2.03 million cases in 2000 to 0.39 million in 2018, and malaria deaths by over 90%, 932 deaths in 2000 to 85 in 2018. National Vector-Borne Disease Control Program (NVBDCP) of India has developed a comprehensive framework to achieve the vision of malaria-free India by 2030. Today, more than half of the world's countries are malaria-free. Next is golden rice. Okay. The International Rice Research Institute (IRRI) and its national research partners have developed golden rice to address vitamin A deficiency (VAD). Vitamin A deficiency is the leading cause of blindness among children and can also lead to death due to infectious disease such as measles. Okay, and here are the important features of golden rice. That rice is genetically modified, that contains large amount of vitamin A. The rice contains the element beta carotene, which is converted in the body into vitamin A. Beta carotene is needed by humans in order to make vitamin A, which is essential for good vision. And the color of the rice is changed from the wild rice to a golden rice. Okay. Next is transmission of coronavirus. Wides in news, according to the World Health Organization, during previous outbreaks due to other coronavirus, human-to-human transmission occurred through droplets, contact and fomites, objects or materials which are likely to carry infection, such as cloths, utensils and furniture, suggesting that the transmission mode of the 29 nCoV can be identical. Okay. Next one is infant mortality rate in India. Here the picture over here, just go with this picture thoroughly. Okay. Infant mortality rate, IMR, is the number of deaths of children under 1 year of age per 1,000 live births. India has reduced its infant mortality rate, IMR, by 42% from 57 per 1,000 live births in 2006 to 33 in 2017, as per the latest government data released on May 30, 2019. Between 2014 and 2017, India's IMR has declined by 15.4%. Next is anemia. Just go with this picture thoroughly. Okay. Wides in news, as many as 58.5% of children between the ages of 6 months and 59 months and 53.1% of women between the ages of 15 and 49 are anemic in the country. National Family Health Survey NFHS for 2015-2016. Anemia is a condition in which the number of red blood cells or their oxygen carrying capacity is insufficient to meet physiologic needs. Iron deficiency is the most common cause of anemia globally, although other conditions such as vitamins B12, vitamin A deficiency and inherited disorders can all cause anemia. Pregnant women and children are particularly vulnerable. Severe anemia in mothers or premature delivery can also lead to childhood anemia. The Union government had launched the Anemia Mukt Bharat AMB strategy under Poshan Abhiyan in 2018 with the aim to reduce anemia prevalence by 3 percentage points every year till 2022. Next is primary health centers, PHCs in India. Primary health center, PHCs, sometimes referred to as public health centers, are state-owned rural healthcare facilities in India. They are essentially single physician clinics, usually with facilities for minor surgeries too. They are part of the government-funded public health system in India, are the most basic units of the system. Apart from the regular medical treatments, PHCs in India have some special focuses like infant immunization program, anti-epidemic programs, birth control programs, pregnancy and related care emergencies. Okay, several states remained laggards when it comes to creating a primary healthcare system with well-equipped PHC as the unit. Bhore Committee had recommended for the development of primary health centers in India in 1946. Okay, sorry. Okay. Severe acute respiratory syndromes, SARS. Like the COVID-19 severe acute respiratory syndrome, SARS is also caused due to type of coronavirus called the SARS coronavirus, that is SARS-CoV. SARS is believed to be an animal virus, possibly transmitted from bats to civet cats to human beings. Both SARS and COVID-19 are types of viral pneumonia, and there are no antibiotics or safe and effective vaccines that work against them. The SARS virus first infected human beings in the Guangdong province of southern China in 2002, with the region still considered a potential zone of its re-emergence. Okay. It was considered the first major novel infectious disease to affect the international community in the 21st century. The epidemic affected 26 countries and resulted in more than 8,000 cases in 2003. Mainland China and Hong Kong together accounted for 87% of all infections and 84% of deaths. Next one is National Health Profile, NHP 2019. Just go with this picture thoroughly. Okay. NHP, National Health Profile, is an annual publication of the Central Bureau of Health Intelligence, CBHI. The first release of the annual publication was in 2005. It covers all the major information on demography, socio-economic status, disease morbidity and mortality, healthcare finance, human resources in health, and healthcare infrastructure. NHP is an initiative which is at par with international standards of data publications. The objective of NHP is to create a versatile database of health information of India and making it available to all stakeholders in the healthcare sector. The publication takes into account recent trends in demography, disease profile, communicable and non-communicable, lifestyle diseases, and available health resources which define a country's health status. That's all for today's session. Hope you like our video. Share our video with your friends. Stay home, stay safe. Thank you.